Good afternoon, everyone, and thank you so much for joining us for our fifth READI Special Populations Roundtable Talk. Today, we'll learn about communication disorders and deaf/hard of hearing inclusion. Before we begin, we'd like to share a bit about the CTSC. The Clinical and Translational Science Collaborative of Cleveland is a collaborative among Case Western Reserve University and its affiliated hospital systems, the Cleveland Clinic, Metro Health, University Hospitals, and the Louis Stokes Veterans Administration Medical Center. We aspire to be a catalyst for high-quality clinical and translational research, both locally and nationally, by changing the culture and environment of biomedical research, sharing resources and expertise, and streamlining the research process to move translational research from bench to bedside and to the community. We're fortunate to have Dr. Janelle Vick, Executive Director of the Cleveland Hearing and Speech Center, and Timothy Skaggs, Director of the Community Center for the Deaf and Hard of Hearing. Dr. Vick and Timothy, the floor is yours.
Good afternoon. Thank you so much, Jaleese, and welcome everybody. We're so happy you're joining us either today or in the future. We're thrilled to share everything that we can about how to be more equitable and inclusive for individuals who, in some cases, really are not going to have the opportunity to speak up for themselves. Cleveland Hearing and Speech Center is a 101-year-old organization, a real gem in Northeast Ohio, where we have the unique distinction of being the oldest speech, hearing, and deaf center in the country. But that does not mean that we don't focus a lot on being as contemporary as we can. We have more programs than I will try to even describe to you today, but what I'll tell you about is that they all focus around the concept of communication. And communication is the means by which we connect with others from our earliest days, even prenatally, all the way throughout life. And so we connect with others at home, we connect with others in school, we connect with others in the workplace, if we're so fortunate to be included. And really, when it comes to science and translational research, that's one of the most important places to connect with others, because as we seek consent from our research participants, understanding how to do so with somebody who communicates differently is probably one of the #1 challenges that I recall from my days as a scientist. So communication and how we address it, we have two different sides to our organization. On one side of our organization, we have a clinical footprint. So we view communication differences with more of a medical model. And so in that area, we have speech language pathology and audiology services. And I'll outline some of the programs within those departments in a little bit. And on the other side, we have more of a social service side to our agency. That's our Community Center for the Deaf and Hard of Hearing, where we do not view communication differences with the medical model. In fact, we view these as differences to be embraced, welcomed, and to help empower and build on the strengths that these individuals have to get them to the highest level of independence and vocation as possible, as well as taking care of their some of their most basic needs. So Tim Skaggs will tell you about that in a few minutes. I just want to sort of connect with all of you personally. I'm new to this nonprofit management world. I started here at the center in 2015, but my entire career leading up to that point has been as a scientist. I did clinical science for most of my career. And then as a faculty member here at Case Western. I think when we think as an agency about how we consider informing and gaining assent from our clients about our intent to either view them as a person who is going to have a treatment or an evaluation, or a person who's going to receive social services, really digging deeper and knowing what the person understands or doesn't understand is one of the most fundamental issues that you will face and that we face. So before I tell you about our services, I want to tell you about my experience as a scientist, because I know many of you are scientists. I studied motion how people produce movements, a lot of times related to speech. But I had a study about individuals who are deaf who used American Sign Language and how their hands, arms, bodies, and faces moved. I used like Hollywood grade motion capture. And my intent for that study was I was working with a collaborator to understand expertise and how proficiency is developed. And this was my first time working really this was before I was in this role. It was my first time working with deaf individuals here in Northeast Ohio. And I share this with you because I didn't understand. I did not get it. So, of course, before we enrolled anybody in the study, our job was to gain assent and consent. And I realized with the individuals, some of the individuals I was working with who are actually consumers that Tim Skaggs will tell you about in a few minutes here at our center, I realized that the idea of research wasn't one that they understood. So the idea that we were doing something for the benefit of society, but it wasn't speech therapy, it wasn't for them, and really, from my perspective, really believing that that individual understood that their participation was voluntary. For a few of the individuals, I could never get there. And the reason I'm telling you that is because many individuals, some individuals in our deaf community experience something called language deprivation syndrome, where they aren't given exposure to language early in life, because most deaf children are born to hearing parents. And without those formative years of learning language, some individuals are never able to get to the higher level understanding of concepts that are far beyond very concrete concepts. And you know that's true in an individual maybe who has a cognitive deficit, but these are individuals with typical cognition, but because of language, can't necessarily be consented. And the problem was, and again, Tim will tell you a lot more about this. I don't want to steal all the glory, but on reflection, it was that I was working with a sign language interpreter. And I thought, I have a sign language interpreter and a person who uses sign language. But there's a third person in this mix that should have been engaged. And that's somebody called a certified deaf interpreter. And that's a person who takes that language and American Sign Language and makes it into a more foundational, basic language and can ensure. So this is a person who's deaf themselves, who can be sure that the person who's deaf truly understands. So I wanted to share that story so you can really understand that it might be far deeper in terms of getting assent or consent for medical procedures or science participation than you ever thought. And that's just one part of the community we serve. So our goal at Cleveland Hearing and Speech Center, our vision is that one day in our community, everybody will be able to communicate effectively. And I like that vision, but I think it lacks a certain something. And that is the responsibility of all of us to make that happen. So I think that vision sort of places the burden on the individual that they should be able to communicate effectively, when the reality is that many people who communicate differently really need an ally, right? So we need an ally who can approach an encounter with curiosity and openness and recognition that what you first assume about a person when they communicate different than you, those assumptions, you need to test them, like you're testing your hypotheses in science. And allyship is what will help our society move forward and become more inclusive and embrace the diversity that exists. So this is really a topic that's near and dear to my heart, and so important as a scientist myself, that we really think a lot about what it means. So I want to talk a little bit about speech pathology and audiology and some of the populations we serve there to give you a better sense for how this can all be applied in your practice. So in speech pathology, I'm a speech pathologist by training, and the vast majority of the clients we serve at Cleveland Hearing and Speech Center are children, and they're working to develop skills in speech or spoken language. So our speech pathologists have a pediatric focus. But as we get into school age, that's when we start to see individuals who have disfluency, people who stutter, I guess is how we should refer to these individuals. And those, I think that's something that many people have maybe encountered in daily life. And what I like to tell people is that stuttering is not something we understand. We're beginning to understand neurologically, perhaps what's going on, but it's none of the things that maybe we were told when I was a million years ago in school about any influence of psychology or the parenting. Those were really outdated notions. Stuttering is a neurological condition that there isn't really a cure. There's some management strategies that people use, but the reality is that what you're dealing with is an individual who may get blocked and be unable to start what they want to say or say what they want to say fluently. And the answer for many people's questions for working with somebody who stutters is to let them finish their message. We're so empathic as humans. We want to help the person, and sometimes jumping in and finishing might feel like the most helpful thing you can do. But by and large, from this community, what we hear and understand and what we can do as allies is give that person the opportunity to finish. It might take longer, but where do we need to go? We feel awkward with those pauses. It violates social rules, but that's what the individual needs, is your opportunity and your time and your space to let them express what they need to express. Another group that we work with in speech pathology as we go on into adulthood are people who have either neurodegeneration or an interruption in their ability to express or understand language as a result of stroke. So the brain controls all these 100 muscles that are used to be coordinated to produce speech, and the brain controls our ability to take these random sound waves and turn them into meaning. And with stroke, about 1/3 of individuals are impacted by an interruption in that. Those patients want you to know that their cognition is fine. Again, as humans, our first, when we sense that something's different or if somebody's unable to express themselves, our first sometimes suspicion or assumption that we jump to is that they can't necessarily think. But over and over from this community, what we understand is that that's not the case. My mother-in-law is a person who has something called progressive aphasia, and she is unable to do anything where she has to name something on demand. She has a break in what we call lexical access, and taking her to the eye doctor it's so difficult. She can't name a letter when she sees it. And again, what I see are caregivers who are so compassionate, but completely flummoxed by what to do. So is there a hard and fast answer about what to do? With an individual, again, I want to just give you some quick tips. With an individual who has expressive aphasia, the inability to sort of get those words out, it can often be useful to fall back on the 2 choices rule. This works with people who have dementia as well. Rather than saying, what do you want for lunch? Or what are you going to order off this menu? It's, would you like the chicken salad or the soup today? 2 choices works really, really well, especially when it comes to gaining consent and understanding. I think that's always, I think the best thing that an ally can do is ask. Whether reading is still intact, whether they have an advocate or a friend who might sit with them and gauge whether they are understanding or not. We like to just assume that somebody's understanding. Have you ever been, I lived in France for a summer, and my family would say, we're going to the beach. I got that. That's all I got though. And we'd leave and everybody had a suitcase. I didn't know we were leaving for a week. You know, there was just pieces that I missed. And so I think for us as people who are collaborating or asking people to help us in our science or in our clinical practice, it's important to ask whether the person wants to have an advocate. If they bring an advocate with them, you still address the person, the patient, the client, the participant face to face. And then you can divert your attention and ask that advocate who's with them, is there additional information I can provide? But remember that it's a partnership with that patient and their advocate when you're trying to gain their understanding and assent during medical or clinical science project. And then I'll jump quickly to hearing loss. We also work with many children and adults who need their hearing loss diagnosed, and we treat individuals most commonly with hearing aids. We do some cochlear implant fitting, but mostly we work in the hearing aid space. People losing their hearing as they age is such a risk factor for dementia. The science is clear at this point. And also getting access to hearing aid technology is showing to sort of bypass the fact that hearing loss is causing dementia. These individuals and all individuals with communication disorders really benefit from being face-to-face in a well-lit environment, not backlit. When somebody has hearing loss, yelling usually does not help. Slowing down can help. Ensuring that they understand you. If they have to ask saying, it's okay, please ask me to repeat. I'm happy to repeat. Again, being a partner in the communication challenge is not it's not making the burden all that of the person who has the communication difference. So those are our areas of service on the medical side of our organization. And as I mentioned before, we have a social service side of our organization. Our Community Center for the Deaf and Hard of Hearing, which is an incredible place. Please visit us. We use a serving deaf model. So we have deaf professionals who work here. And I'm so proud to introduce you to Timothy Skaggs, who's the director of our Community Center for the Deaf and Hard of Hearing. And our sign language interpreter today is Todd Smith. But over to you, Tim.
Thank you, Janelle. I'd like to elaborate a little bit on what LDS or language deprivation syndrome is. It's an important concept, and it's really helpful when identifying children who may or may not have LDS. I often use the analogy of a flower, right? So there's two flowers. The first flower is you, and the second flower is me as a deaf individual. Typically, when people go through school or interact with their parents, maybe mom and dad are having a conversation, they might ask, how's your day? How are you doing? Maybe you go to sports, activities, you often collaborate with each other, you have conversations, there's no barriers in place. And I could go on with different examples. This flower will do well. They have sunshine, they have water, they have support, they grow, they prosper, and these children are often better off. With deaf children, that's not always the case. Perhaps this child is lucky and they have great access to support. Maybe mom and dad sign at home. Incredible. Maybe the school provides interpreters. Great. Oftentimes that's not the case. So it's oftentimes schools try to provide resources that they think are good enough, but that may or may not be the case. Maybe after school programs, maybe you have an interpreter during school, but not for after school activities. That can be very frustrating because you're there and the access is limited. Maybe you go home, mom and dad can't communicate well with you. You can lip read, yes, and that's a nice tool to pick up a little bit, maybe 20 to 30% of what's going on in a conversation, especially in a large social situation. It could be even less. And let's not forget, we're talking about a child. A child with LDS has a hard time to get access because they have a limited understanding of the world. A hearing individual might overhear mom and dad calling a plumber, asking for them to come out. And you might understand incidentally, oh, when I pick up the phone, mom and dad will call someone and I can ask someone for help. So again, we call those sorts of situations incidental learning, and you benefit from that, but a deaf child may not. And those are some of the challenges for a deaf individual as they're growing up. Without direct communication, it's tough. When you're filling out an intake with a deaf individual, What is your social security number? What is your address? Some of these basic questions can often be very hard to figure out or to pull out of that person, because the time it takes and the practice that most of you have had growing up is just not present in a deaf individual. Cognition and development is the most effective up until roughly the age of 5, and deaf individuals may not have similar access until they're 14 or maybe older. We talk about hearing aids, we talk about cochlear implants. Those are fine, those are tools, but understand that they are not 100% access to the world at large. A deaf individual might feel awkward. If a car drives by, a deaf individual may not be able to identify if it's a train or a car or a bus. If someone is talking, I might not be able to identify whether it's Dr. Vic or someone else in the audience. Some of the exposure is limited. So as children grow up, developing an understanding of the world at large is so important. And that includes access to interpreters. Interpreters are wonderful tools. But the problem is, suppose a child is 6 or 7 years old and an interpreter is provided, but they have no prior language. What benefit does the interpreter provide in this situation? Children need this additional support. They need extra time. They need one-on-one collaboration and development to figure out what's best for the individual. And number one is finding their language access and making sure they have exposure early on. We have deaf professionals out there in the world who are willing to provide their experience and provide support. I could go on and on about this topic. I could go on and on all day, but I'd like to turn it back to Dr. Vic. You're on mute, Janelle.
No, I hear you. Hey, Tim, would you mind just sharing sort of the nature of the services that you provide in the Community Center for the Deaf and Hard of Hearing, and really what basic needs our community is looking to have you fulfill?
Sure, absolutely. So the Community Center for the Deaf and Hard of Hearing focuses on more of social case management side of things. So providing an example, a deaf person is behind on their bills, or again, understanding that the world is predominantly English. A deaf child may not have the best English skills. Typically, we see deaf individuals graduate with a 2nd or 3rd grade reading level. So if a doctor or a medical professional provides a brochure, provides instructions to take medication, provides a consent form, which they need to read and understand, they might come to our center and ask us to provide an explanation. Someone may not have a concrete understanding of why they should pay their utility bills, their electric, their gas bill. We explain to these people, again, remember that there are gaps in incidental learning, why you need to pay your bills. We provide ASL classes for families of deaf individuals, sometimes out in the community. Sometimes we visit corporations directly. Suppose that a corporation hires a deaf individual, we might go out and provide advocacy work. We also provide VR or vocational rehab services, so related to employment. Again, with the deaf individual coming into the workplace, they might not have a basic understanding of what a resume is or how to interact appropriately with their boss. So as an example, someone's day-to-day normal behavior might be unusual to a deaf individual. So we might provide accommodations or advocacy for the corporation. We provide domestic violence and sexual violence support to make sure that services are provided for everyone, that everyone is included. Many of our clients often suffered to some degree from LDS, largely with understanding the English language. And that's tough, because if I go to any of your websites or your brochures, whatever, the point is it's an English world and there's limited access. There's no ASL access. There's no support. So many of our deaf clients rely on our support for that reason. Janelle, would you like me to add more?
It made me think, Tim, about when I was a scientist, right? And I was struggling to be sure that the person I wanted to include in my research study who is deaf really understood. And so I did the part where I hired a sign language interpreter, but what I didn't know is that I could call the Community Center for the Deaf and ask for maybe somebody to come as an advocate for the client, or that we could go together to the Community Center for the Deaf and sit down with the consent form with one of your professionals to really be sure that I could get the understanding of the deaf consumer. Is that true?
It is.
So that's, I never put all of that together until today. So thank you for giving me that insight today. So that was a very fast overview, I think, Jaleese, even though we took nearly a half an hour, but we're so happy to address questions that anybody might have in the community about how to work with any type of individual who we might serve here at the center, or anybody with a communication difference or disorder.
This was absolutely fantastic. I am sitting here taking copious notes. And I think before we jump into the question and answer portion, could you remind us of some of the terms you used? The term ally, and then there was another individual that should be involved in the interpretation process. I think it was a certified language.
It's a CDI, a certified deaf interpreter. Now, I think we might scale back and just say deaf interpreter, because in the state of Ohio, we have a real shortage. I think there's one, right? Skeggs. Yeah. Go ahead.
Yes, this is Tim. I'd like to add on that. I'd like to add a little bit of context about what the CDI does and what their role is. I'll just provide a brief explanation. So we have an American Sign Language interpreter, right? Understand that American Sign Language interpreters are not native speakers. Native speakers trump all. So if I go to Mexico, who would I rather help me with the interpreting process? A native Mexican or someone who learned Spanish in college, right? You would choose the native speaker. So we're talking about a similar concept, right? ASL is very unique because we rely heavily on facial features, on expression, on body language, on gestures. There's a lot of information to pick up on. Sometimes a deaf person cannot understand an individual because of the lack of those features. If you're happy, you raise your eyebrows. If you're sad, you lower your eyebrows, just to give some very simple examples. If the message isn't clear, or your body language or your facial features aren't on point, the information is not clear. So in order to facilitate an accurate message, a deaf interpreter may be necessary if someone is really struggling to understand a specific concept, because they, especially with, with children, that could be a tremendous benefit with working with children. Oh, my parents are upset, or whatever the case may be, just to really drive home the natural language and the expression, because we are deaf, tone, intonation, and everything, while you all rely on the ear, we rely on the face and the body language and the expression. That's just a very simple explanation, but I hope that clarifies some things.
Absolutely, thank you.
Can I just add one more thing, Jaleese? That we sometimes gloss over. Tim and I spend so much time here that we forget how to where to, sometimes the most basic. I want to just say that for this sounds, I just have to say this out loud. The responsibility of sign language interpreting falls, according to the Americans with Disabilities Act, on the organization who is hosting, right? So we and people just don't know, but people assume that people will bring an interpreter with them, or that their family member could do it. And that's not the case at all. That's a really bad use of a family member. I'm so grateful for that film Coda. If you haven't seen it, please watch it, because the opening scene, it shows how awkward it could be if you were the child of a deaf adult expected to interpret for their family member in the middle of a really awkward conversation with a physician. But that's also true in the courts. It's also true in employment settings. So the responsibility is for the organization who's hosting. So if somebody, if you invited a potential deaf participant for your clinical science trial, it's your responsibility to also request a sign language interpreter. Now, pro tip is that we have a shortage of American Sign Language interpreters, and they're hard to come by. So you want to request that interpreter at least 2 weeks in advance, sometimes 4, like as much notice as you can give, especially if you want that interpreter in person. You want to do that. Now, how do you get an interpreter? There are a lot of different ways you can do that. You can request, we offer interpreting at Cleveland Hearing and Speech Center. You can request it on our website, but there's also a couple of companies who are local called Purple and Sorensen. Best practice, if you want to really ensure great understanding for a patient or a clinical trial participant, you want to have an in-person interpreter with an in-person client or participant. Comprehension is going to be the highest if you have in-person interpreting. You'll see video interpreting. We're using video interpreting today. Comprehension is harder to gauge via some of the things Tim just told you about with facial expression, and the use of space in this visual language are really hard to gauge in 2 dimensions. So in person, you can really get, and the space in front of you and around you in American Sign Language is used to convey concepts. So if you can't gauge the distance, you can't tell the closeness of a relationship that maybe you're trying. So there's a lot there. Sign language interpreting is expensive. On average, $60 to $70 an hour. And often the interpreting agencies will charge you a 2-hour minimum. But it's a cost that should be covered by your federal grant. If you're going to include these participants, you want to include that in the proposal. We're happy to help you scope out the cost for services over time. We do some federal grants here ourselves with the Office on Violence Against Women. So we're pretty good partners right down the street.
And I just added the link to the center's language interpreting services so that people can, like you said, plan for it. Just like we did for this series, we will have interpreters during our live workshops coming up in the fall. And we want to make sure that we are being proactive and building for inclusivity. It doesn't matter if one person who doesn't need this service shows up, but if people begin to understand and know that READI programming and the CTSC, this is something that we provide, we hope to welcome the deaf and hard of hearing community with open arms. And when we think about that, Janelle and Timothy, what are some best practices, with that use case, like not knowing whether or not we will have a need, but building and preparing for it? What are your thoughts on that?
Do you mind if I jump in, Skaggs? And as a hearing organization who's worked really hard to try to get this right, and we're still not getting it right. We work really hard, but I just want to say that some of the things that we find best are to be sure that when you announce an event that you say that interpreters are available on request. So you want to get the RSVP and the request in really early. Another accommodation is real-time captioning. Zoom offers automated captioning. It's not awesome, but it'll do it in a pinch. If you really want to get it right, you can hire a court reporter. We can give you the number of who we use so that you have real-time captions that appear in the subtitles and identify the speaker. Now, the most important thing is to remember that we're all humans. And so we do a preamble before every meeting that says, we care about communication. We're using these forms of accommodation today. Please don't talk over each other. Please raise your hand. Please don't use the hand raising reaction because it shuffles the tiles. If you need to so deaf people need to multi-pin. So just say, if you need to and you can't, let me know. And then the key thing that we found that really works is to say explicitly to our interpreters, who are the consummate professionals. They are not supposed to, they're just the voice and the signs, to say, if you need us to repeat something, would you stop us? It's okay, we're open to it. An interpreter isn't trained to say, hold up, I have no idea where we are. But if you say that communication and information access is #1 most important, please interrupt us if you need to. The interpreters will say, I would be happy to. Tim probably has better suggestions.
Yes, I'd like to add some points. Dr. Vick is right on the money. I think the pre-meeting time is so crucial, especially for interpreters. You don't need to provide names and specific information, but it's important that you give them the concept of what you're talking about and what you expect to get from the meeting. Perhaps your language use is a little bit more advanced. Maybe you use jargon or particular technical language. Provide that information to the interpreter, or perhaps think about strategies how to lower your language level. You know, this isn't about you having an ego necessarily. It's just more so helping the client understand what you're trying to get across, and that can help the interpreter as well. But really getting to the point, preparation is so crucial. Asking the client if they understand everything, maybe taking a break and say, are you catching everything so far? It might take 5 times, depending on the language level of the person. Here at CCD, you know, an intake form typically takes 15 minutes, but sometimes it takes 2 hours just to complete a single form, which means that your meeting with a deaf person should probably be allocated for a longer time frame. If you have an interpreter and they have a 2-hour minimum, make use of that full time, because you're paying for it anyway. Those are some of my suggestions.
Thank you. It seems that we have a question. KM Adams, if you'd like to come.
Thank you. Disclaimer, I am not a scientist. I actually am an equity specialist and investigator with the Office of Equity at Case Western Reserve University. And I currently have a reasonable accommodation, and our office is trying to work through developing a protocol for faculty and staff when they need interpretation services. So, and the other thing is that with our Title IX and other cases, I am going to check, but I do not know if we have anyone that's ASL, an ASL interpreter on our list for advisors, because if someone has a Title IX case, they can have an advisor. And I'm going to check with my supervisor and my director to see if we have anybody. So that might be something that I'll reach out to you about. But if there are any suggestions for any type of materials to try to develop a program for that or a protocol for that, I would be greatly appreciative. Thank you so much.
This is Janelle KM. I want to encourage you I just am really grateful and so appreciate the way you're thinking about this, because it is getting it right takes a lot of trial and error. So creating policies for faculty and staff for accommodation is something well within realistic, and Tim's team helps companies do that. Because I think everybody thinks I can't employ a person who's deaf because I need an interpreter 24/7 and we can't afford that. It's not quite like that. So Tim, do you want to talk about how to approach it?
Sure. So again, I think there is often a misunderstanding. Often, if you reach out to an interpreting agency and explain your concerns, these people are trained to answer those kinds of scenarios. With maybe you need even greater advance notice. It really depends, but Janelle is absolutely correct. I mean, there's no quote unquote best practice. I mean, ultimately, the best practice is to have someone on staff 24/7. If you have the means to do that, great. If not, consistency is so important. If you have a different interpreter every time, that's fine, but just understand that they might not have access to the same language, the same terminology that the previous interpreter has already been familiarized with. So that being said, a person who is well-versed in the language and also well-versed in the topic that you're discussing is an even greater benefit to you.
This is Janelle. KM, most importantly, is to ask the individual what accommodation they're requesting. We sometimes assume, and you might assume, oh, we can provide captioning and that should be okay. But if the person doesn't have literacy skills, then that doesn't work. That's not information access. So your goal is to think for your staff and faculty, what gets them access to the information. So for us, we don't put a video out without sending it out for captioning, but that's because we know, a big proportion of our staff will benefit from captions. For others, you have to have an interpreter, and it just varies by the individual. But one exercise I would encourage people to do is try having a Zoom meeting with your speakers off and your microphones on, if you have 2 hearing people, and just with the captions on, and try to have a meeting. Because what you'll notice is you're reading these captions and you can follow what they're saying, but you can't see what their reactions are. You miss so much. Also remember that captions and interpreting have a lag time. So hearing people just stumble through our meetings, we just keep go, 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 go. And we don't give time for the person who's deaf or hard of hearing to get the information to even say, I have an answer to your pop quiz question, or I have an idea to share. So we really, Tim talked about the time it takes to work with a person who's deaf. So when you're thinking about that, easily double the time that you're planning on, if not triple, just to be sure everybody has an opportunity to be part of a discussion. This is Janelle. In the chat, I had a question about where can somebody learn American Sign Language? And I'm thrilled, of course, to let you know that we have a great program in American Sign Language that's extremely affordable here at Cleveland Hearing and Speech Center. And I know that there's a course offered at Case Western in the Communication Sciences program, but Tim can tell you more about our ASL schedule.
Sure, I'd be happy to. So the ASL schedule is typically provided in sections 3 or 4 times a year. Typically, it's roughly a 10-week course. And during that 10 weeks, it's once a week on Zoom, taught by a deaf individual, meaning this is someone who is a native signer who knows the language. We can also provide, I'll just provide an example. So suppose out in the community, the terminology is usually very broad. But if your terminology is perhaps specialized to your environment, you're looking for specific signs or specific language for a specific situation, we can be flexible and provide more specialized ASL classes. You can see Dr. Vic provided a list of where you can sign up. If you're interested, it's once a week, it's an hour of your time.
This is Janelle. I'll also put a plug in for our ASL Teen Summer Camp this summer. It's just an hour in the afternoon. It's only $40 for 6 weeks. And it's an exciting time to expose kids to language. And taking a class on ASL is a great way to become an ally. When the class is taught by a person who's deaf, hopefully you get a chance to learn a little bit more about deaf culture and deaf just everything deaf. And I think that helps our community grow richer, even if you just have a little exposure to the language and the culture.
Agreed.
Do we have any other questions? Anita?
Yeah. How many locations does the Hearing and Speech Center have, just out of curiosity?
This is Janelle. Thanks, Anita, for your question. We have 4 locations right now. Our headquarters is here in University Circle, right across from the Cleveland Institute of Art, actually. And then we have smaller locations around town. We have a location in Lyndhurst, We have one in Broadview Heights and one in Westlake. I should also sort of put a plug in for everybody. We have a new outreach program called Project Ella, which is Early Language and Literacy for All. As part of that, we have community health workers out in the community working at partner organizations, helping to build trust with the community so that we can really work. We want to screen as many children as possible, and through building trust, get the kids who need help in for help as early as possible. For language development, whether a child is hearing or deaf, the most critical period is the first 1,000 days. That doesn't give you much time. That's before the child's 3rd birthday. We want to have as much of those language building blocks in place so that they can be ready for pre-literacy and school skills. So part of Project Ella is that outreach piece. And so if you know a partner organization that would love a presentation for family caregivers about early language development, our community health workers are available to do this free of charge. And for children who are birth to age 5, speech pathology services at our University Circle office are completely free. We cover the cost of the copay, or if it's private pay, we cover 100% of the cost. And the reason is that this investment is so critical for a child's future. And we think it's essential for our community's future as well.
All
I'm
right.
going to put the link for Project Ella in the chat so that you can take a look yourself. If you need more help, we're happy to share that with you.
Thank you, Dr. Vick. Thank you, Timothy, and thank you, Todd. This has been absolutely wonderful, highly enlightening. I mean, you did not leave any stone unturned in terms of just the basics and the foundation, and we really appreciate that as we try to be more diverse, equitable, inclusive, and accessible in our program offerings and as a research community as a whole. I'm going to share the screen now to share a bit about what's next for our READI Special Populations Roundtable talks. In June, we will be focusing on sex and gender with the LGBTQIA+ community as the focal point, and that'll be on June 30th from noon to 1 on Zoom. Kate Mozinski from Equality Ohio will lead that discussion. And what can you do today besides all of the wonderful tips that we have from our guest speakers? You can schedule a READI consultation at spark.case.edu, sign up to attend future programming and join our listserv. And why not join the Center for Speech and Hearings listserv as well? And you can review CTSC DEIA resources. We'll give you a couple of minutes for virtual commute time to engage in some meaningful activity before you head to your next Zoom or maybe in-person meeting. And we thank you so much for joining us. Please connect with us, and we hope that you have a great weekend.
Can you hear me?
Yes.
Hi, I was trying to, anyway, I'm a provider and I work with your excellent service with the patient. And boy, could I use some tips on how to calm myself down and hang in there for the long discussion to try to get to understanding. It's really frustrating because it takes so long. So any tips you have as the person working with the English, just anything you can say to help have patience and get through it to help the patient.
This is Janelle. Amanda, I'm not sure which population you're working with and the time that it takes, but I find my best approach for me that centers, aside from breathing, is recognizing my communication privilege.
Yeah.
Right?
Okay.
So honoring it, that I have this privilege to just be able to, jump back and forth and have these quick verbal interactions, but that's a privilege. And if you recognize that as a privilege that not everybody shares, it becomes much easier to get through those moments and recognize that we take it for granted. And the shared humanity piece, that this person also deserves that access to information. It's just going to take more time. I think, we're so easy to, I put my arm out because of walking with my grandmother, and when I was a kid,
Yes.
holding her up took so much longer, but I'm so glad I took that time with her. And I like to think about that many times as well.
Yeah, thank you. I appreciate that. And I appreciate hearing that they don't have, I work with an adult who's on dialysis and has many other concerns. And I'm trying to help them understand what they were in the ER for and what the follow-up is, et cetera. But I appreciate you saying how they don't have the things that we learned as a small kid. So not only are they hearing and vocally impaired, but they also don't have all the connections. So I appreciate you saying to remember it's a privilege.
And
Okay,
Amanda, nobody understands kidneys. I'm sorry. But they're so important.
Yeah. Yes.
Tim?
Yeah.
Yes, this is Tim. I'd like to add, just from the deaf population perspective, just to give you an idea of what it's like sometimes, right? So sometimes there's a little bit of extra pre-work. Print out pictures. Try to explain what those pictures mean. This isn't something that's exclusive to a deaf or hard of hearing population. I think many people could benefit from this. Just providing some sort of visual stimulus. Understand that some of the people we've talked about today have access to a second or third grade reading level, but a picture can explain a lot in such a short amount of time. And it might not be instantaneous, but after some exposure, I think you could have some real success.
And that's very helpful. Thank
Yeah. I just wanted to, can you hear me?
Mm-hmm.
Yeah.
I just wanted to say that I have this sort of issue sometimes on my team where I work because I'm a visual learner and 65% of the population are visual learners. I'm not really a hearing learner. Even though I can hear, I learn from seeing. And so maybe that will help you understand like that just because a person can't hear doesn't mean that they're a hearing learner. They could be a visual learner just like 65% of the population. And, that might help with teaching. I always think of working with someone who, like, I'm taking care of my 92-year-old mother who's got hearing cognition. And I think of it as education. To me, it's just education when I'm walking through even shopping. Like, do you want to go this way? Do you want to go that way? You're educating. You have to act in real time. It's not about you thinking about your future. You have to stay in the moment with that person until you're on the same page. And if you can stay in the moment and not think about the future, I think you'll have less anxiety when you're working with that person.
I think what I need, I appreciate what you guys are all saying. It's very helpful. But I wonder if there's a way I could reflect that in my charges for my time, because I am allotted so much time per person, and working with hearing impaired or so takes longer. So I wish there was a way I could perhaps reflect that in my billing or in my communication with my superiors.
This is Janelle. It reminds me of in the university setting, you can request an accommodation of double time or time and a half. It feels like we should be able to request that as an accommodation for our patients, but you're right, there is no accommodation. We need to stand up and do something about this. You're right, Tim.
Yes, this is Tim. I'd like to mention that the CCD team struggles with that a lot as well. Sometimes we only have an hour because we need to meet with a client. Sometimes we'll have two clients come in and not realize it. This is something that's not unique to you specifically. I would always say that documentation is critical.
Yeah.
Let that person know, hey, you're over time. Can we meet again? Or just have some actionable items to show your supervisor. Say, hey, I'm consistently meeting with this person and I'm consistently over time. I mean, the accommodation process is so important, but recognizing that you work on a schedule and you work on a budget.
That's good. Very good.
Very helpful. Thank you.
Thank you. And if that was the, oh, do we have another question?
I just wanted to say, so if my boss asks me for what that's called, what did you say it was called? It was an accommodation that I could put in my billing, did you say?
Oh, this is Janelle, Amanda. I was saying that students can seek an accommodation of extra time, but I don't know that patients have the same ability to ask to have an accommodation. Like there is no, what I was acknowledging is, yeah, you're right. I don't think there is a billing accommodation or a productivity accommodation. You could talk with your scheduler and your supervisor about how to make it possible when you know that patient is coming and knowing that it'll take more time and not get dinged on your productivity. But that would, it'll take some education. And another idea I had, Amanda, is it's not unusual for your patients, not you, but the patients of the community to come to us with like a bag of insulin and they'll say, I have no idea what this is, because they missed out on that education because of the communication difference. And so partnering with us in that process, if you have the information and you want us to work with your client, you could have them call us and get an appointment and bring the materials, and maybe we could work through some of it with them.
That's great.
And if I can make a suggestion, so one of the things that we do, if we have issues, let's just say with maybe a department that's dealing with equity issues with retaliation, one of the things that we may go in and do is we actually may go into the department and do some education. So maybe one of the things you might want to think about is partnering with the center to come into your space and educate your supervisor and everyone else about this issue so they understand it. And it's not coming from you. It's coming from the professional individuals that are explaining to them, this may take more time because of this population. And you need to make sure that you're understanding what you are giving them or what services you're providing. And it may take extra time because you saying it, your supervisor might be like, you know what, no. But when somebody else is coming in and saying it from a professional point of view, it might be taken a little bit differently and they might want to understand more.
And I think you're right, because it gives it an objective perspective. And then you've got, the law policy is behind having an objective observer come in. And you're right, it takes the pressure off of the person within the group, which is such a great idea. Thank you for sharing that.
This is Janelle. Tim and I both agree, Cam, you're exactly right. And we do have presentations and education and trainings available that we customize. That's one of the services available in our community center for the deaf. Tim is amazing, like at the training. So you'll be fortunate if he is your person.
Perfect. I'm loving all of the suggestions, recommendations, and questions, and just the great discussion that's flowing. This is great. And if we don't have any other questions, comments, maybe a final takeaway from Tim would be great. And then we'll close out and everyone can enjoy the rest of their day. But this is absolutely wonderful.
Sure, I'd love to do that. So my final comment that I'd like to make today is please try to meet a deaf or hard of hearing individual where they're at. They are an individual. Maybe you are their first conversation in a week, maybe a month, maybe a year. Someone might be compelled to overshare with you. Please don't take that personally. Just understand, hear that person out. Sometimes deaf people tend to be a little bit more collectivist and overshare. Sometimes a person could be incredibly isolated and doesn't know how to share. So when you see a deaf person, say hello, ask how they're doing. Those kinds of things go a long way, especially if you deal with them in the future.
All right.
May I add one thing? Sorry, Jaleese, but there was one person working in with facilities who would clean on our floor, and he had earbuds in. And sometimes I would like shout down the hall to him because I would say like, oh, I'll leave my door open. Could you close it when you're finished? And then I found out he was deaf, and he was mostly deaf, but he was wearing earbuds so that people wouldn't know he was deaf. And it changed my attitude about dealing with everyone, not just him, but like make sure people see you when you're talking to them, that kind of thing.
That's a great tip.
Yeah,
Thank you for sharing.
sure.
Okay. Thank you again, and have a great weekend, everyone.
Thank you all.
Bye.
You too. Thanks for having us. Take care.